My name is Eunice. Welcome back to my YouTube channel. Today, I want to continue my discussion on depression. About 2 weeks ago, I started this topic. And then in the first video, I discussed some of those signs and symptoms. And today, I want to talk about predisposing factors. If you are wondering, what are the causes of this depression we are talking about? Well, it's hard to come up with the causes of depression, but there are factors that can make people susceptible to depression, and those are the factors that I want to discuss today. Number one is family history. So if there are people in your family that had depression, you are at a higher risk of developing depression, especially when there are other factors involved, which I will discuss in this video. So let's say one of your parents had depression or other mental health issues. You might want to look into that because it could be genetic. And talking about genetics, there are some happy hormones, I call them, in the body. They are neurotransmitters. If their levels are low in the body, especially serotonin, if the level is low, depression could occur in such people with low level of neurotransmitters. I don't want to go into details about neurotransmitters, but it's just something to know. And knowing that it is not the fault of these people. That's why I said in the first video that there are some depression, there are some people that their depression can be preventable, some they're not preventable. So in this instance, that is genetic, and it has to do with the imbalance of chemicals in the body. That one is not preventable, but it's treatable. So another point is the personality. Some people, they are so hard on themselves based on their past experiences in life. It could be their childhood. If they have low self-esteem, or they are overly critical about themselves, they are prone to developing depression, especially if other factors come into play. So those people that have low self-esteem and they are critical about themselves and other personalities, they could easily develop depression compared to people who don't have low self-esteem. Another thing is hormonal changes, especially in women. Women go through phases in life. There's the puberty, there is a pregnancy, postpartum, menopause, and all of that. So during pregnancy, it's a stressor on its own because of the hormones and all the changes in the body. Some women go through depression even during pregnancy. Some, their depression is postpartum. So it's not their fault. Again, because some people have this orientation that if you develop mental illness, it's your fault. No, it's not their fault. My aim is to help us see those factors that contribute to mental illness, so that when we see people with depression or other form of mental illness, we know that we show compassion and know that it's not their fault. So I've mentioned pregnancy, postpartum. Another thing is menopause, because the women hormones, estrogen and progesterone, they decrease during menopause, especially estrogen. Some women have to go through hormonal therapy during their menopause because the symptoms for some people, it's so extreme. So it varies from women to women. Some women will not need hormonal therapy, some will need it. Their own menopause symptoms may be to the extreme. Hot flushes, low moods, swing moods, and all of that. Insomnia. Some people experience headaches. Some people experience painful intercourse, and all of those signs can contribute to depression. Another thing that I want to talk about in this video is feeling of loneliness. So I want to cite some examples. For widows and widowers, they've lived with their spouse for so long, some 30 30 years, 40 years, even if it's 2 years, they feel lonely. And that is why we see all these love scams across the globe, because people are lonely and they are seeking for love again. They want to give love a try again. Or people who are divorced, maybe they are going through divorce or they finalize their divorce. It's a loss in their life. And that's is another point to look at. When you lose someone, whether by death or separation or divorce, is a loss. It's something that people grieve about. People grieve when they lose their loved ones, when they lose their jobs, and I will talk about that too shortly here. Not only when someone dies that we grieve also when we lose relationship or things that are very important to us. So now the another point, which will be point number 6 now, is loss. And like I transition from loneliness to loss now. I've mentioned some of those things. So some people losing their jobs can trigger depression, especially if they have other predisposing factors like the genetics that I spoke about earlier. It could be something so dear to them, that is special to them, that it may not make sense to you, but that is their life. It is something of treasure, of value to them. If they lose it, they can go into depression. Another thing is stress. Some people struggle with work-life balance. Some stress may be due to promotion. Losing job can constitute stress, and some can go into depression because they lost their job. Some is promotion, because promotion comes with responsibilities, and people who have a lot of it and they are not prepared to embrace such responsibilities, even when they are prepared, the responsibilities could be overwhelming and trigger depression. So also child rearing and child bearing. Also, people who have their house full of kids and they are stressed and they are having a hard time to juggle looking after their kids and balancing that with work and other responsibilities that they may have. It's there. Some people go through that. The last but not the least is chronic illnesses. Some people live with certain conditions, especially the ones that they have to go to sleep, wake up in pain. People going through cancer treatments, people living with excruciating pain due to one condition or another, they can develop a depression. So all these points, I set them out there, like 8 or 9 that I've mentioned in this video. If you have people around you going through all of this, please empathize with them. It's not their fault. Support them as the best as you could and seek help. If you have all of these things going on in your life, it's okay to seek help. Seek help. There are therapists across the globe, wherever you are located. Reach out to your therapist, talk to your doctor. Depression is manageable. You may not be able to prevent it if it's genetics related, but it's treatable. Until I come your way again, my name is Eunice. I'm a psychotherapist nurse. Talk to you soon. Bye-bye.